The following segment is sponsored by Urologic Surgeons of Washington. Their doctors want all men to know that side effects of prostate cancer treatment are normal, and that shouldn't keep you from getting life-saving prostate screenings. Those side effects can be cured with routine procedures. Dr. Engel, so great to have you back here. How are you?
Thanks for having me back.
Absolutely. When we're talking about prostate cancer, what are some of the most common side effects of prostate cancer treatment?
Well, it has a little bit to do with what treatment is offered, but let's just kind of, my bailiwick tends to be surgery. It's mostly surgery and radiation. And the two biggies, the ones that patients are really going to worry about, are ED. That's always in the discussion. It's always a part of side effects from treatment, and incontinence, which is leaking urine afterwards. So those are the two biggies, and that's really the challenge that the patient is going to be confronted with when they're offered treatment.
Why is ED such a common side effect for men going through this treatment?
It really just has to do with where the prostate is. The prostate is a gland that's connected to your bladder. And so as you can imagine, you urinate through it, and it's the next step is the penis. So things that involve blood flow, the nerves for erections, are all neighbors of the prostate, and whether they get radiated or whether they get affected with surgery, it's going to, one way or the other, be collateral damage to some degree.
Okay, so how can you help with that? Or is there a way to treat it, fix it? How can the men get help for that?
Right. And this is really, when we counsel men for prostate cancer, that obviously we're talking about cancer, and that's very scary, but this is probably at least number two on what patients want to know. How are you going to help me? How is this going to be? So we talk about the fact that it does tend to be part of this. Men are usually thinking that it's going to be as easy as pills or the common ones that you know of. And unfortunately, although on average that helps a man that hasn't had prostate cancer treatment, pills don't usually work. So the key is to know there's always something we can do. The first step commonly is to do something like injections. So this is a daunting thought, injecting your own penis to get an erection, but it's a very common thing. And then that spans all the way for certain select patients to even surgery, implanting penile prostheses. There's always a way to get it done. And that's really the thing I stress up front, that this is going to be part of your recovery. And as long as you view it that way, no different than rehab after a hip replacement or something like that, there's always going to be something we can do to make somebody happy in this regard.
Yeah, I want to emphasize and reiterate that. I mean, yes, your body's going through a lot when you're going through prostate cancer or any kind of cancer. So things are changing, but there is hope. It's not the end of the road. Like, there's ways to still help you live a healthy and fulfilling life.
Yeah, that is the key. And that is, there's usually this thought that there isn't hope, and it's all about managing expectations, making it clear that this will be part of your journey, but I'm here to help you every step of the way. And you tell me how much help you need, and we're going to get you in the game. And there's definitely a way to do that. Of course, we're hoping that men get their own erections back on their own, particularly with surgery down the line. But the sooner the person asks for help and succeeds, I find mentally that's a far more healthy situation, is to tackle it and then hope you get it back on your own.
Absolutely. Dr. Engel, such great information and advice there. Anything else before I let you go on this topic?
Yeah, really just to say, just in general, even without prostate cancer, it's one thing that always strikes me, even when I'm with friends, other doctors, it's people don't realize how common this topic is. They don't realize, even in a 50-year-old, maybe half of those men have some problem with their erections. So it's really just it's nothing to be embarrassed about. Just seek help. And people like me are very happy to help you.
Well, we are happy that you are here sharing that with us. Thank you so very much.
Thank you for having me.
Visit dcurology.net for informational videos or call 202-223-1024 for an appointment.